Hi, I'm Ash Thornley-Davis at Visionable, presenting to you today from the back of our connected ambulance. So I'm going to run through some slides that show you a little bit about Visionable and the work we're doing in some specific customers, including Southern Health Foundation Trust. So to give you an overview of Visionable and why we exist, we were founded in the NHS by Alan Lowe and Lord Victor Adebowale almost a decade ago now. Alan was working as a frontline program manager at St Mary's Hospital and was tasked with putting video conferencing in for cancer MDTs that were running across the patch, and very quickly realized that there was no platform that would easily work across several different departments and locations, different devices. So rose to the challenge and founded a company, Visionable, that allows multiple locations, multiple devices, multiple participants to share clinical grade imaging across all devices. He pulled together a team, including Lord Victor, to help push this through the NHS and into global healthcare. And to date, we're working with over 100 NHS organisations and 27 NHS trusts. So we realise that on our planet by 2050, there's going to be over 9 billion people on this world. And there's three core aspects where we're trying to help. This looking at healthcare models, healthcare providers, and healthcare professionals. And we believe we have the answer to some of these challenges. So we're aiming to redesign healthcare and the way that healthcare is delivered through this digital age using technology. So what makes us different to anybody else on the market is our technology itself. And we own this platform. We have 29 patents on this platform, including independent audio and video streams, which we'll show you in a minute. And we're also a platform that is agnostic. It can work across multiple devices and also has that medical grade certification, which means we're guaranteeing the accuracy of a medical image that's being transmitted from point A to point B. What this means is that not only are we a platform that's reliable and secure, but we have the depth and breadth of knowledge of inner workings of health systems, which means that regardless of where you sit and which discipline, Visionable can slot into that pathway to help transform patient care. What that's enabled us to do is some really fantastic things, including connected ambulances. And this video here is going to show you how we're using the technology in the back of ambulances in the east of England to connect potential stroke patients to consultants who are at the remote end.
Can I see the patient? Okay. Have you had this sort of headache in the past? As a paramedic, we go to lots of different types of call, whether that be people who are in labour, road traffic collisions, people with chest pain. It's very difficult to know everything about every subject, but being able to speak with a consultant gives us a lot more experience and also shares their knowledge. Can I just see you lift your arms up above your head? Is that all right? Good, fantastic. Now, with your left hand, can I see you touch your nose? Okay, good. That's fantastic.
For the consultant, it gives more information about the patient's condition.
If I wanted to examine the patient, I can give them specific instructions and I can see firsthand. So if there was ever a clinical doubt as to what the condition may be, this should be what future medical care looks like.
So what we're seeing here is a stroke consultant using a fairly traditional medical cart loaded with Visionable technology, which is then transmitting over 3G and 4G to the back of the ambulance to help speed up that patient pathway. So we have three core products in our offering and three products that complement each other in terms of patient journey. We've got our MDT collaboration platform, which enables multiple teams across multiple locations to share that clinical imaging remotely, which also means we're able to make faster and more decisive decisions in real time. We've also got our virtual consultation platform, which is the core platform being used at Southern Health NHS Trust. This enables the clinicians using the same platform they're familiar with for MDTs to connect a patient remotely on their smartphone or laptop or iPad in a very simplistic manner to enable them to have that consultation in person via video. And the final platform we have is called Visionable Connect, which we built in response to COVID-19 which is being used across intensive care units to allow patients to connect to family members at home who can't be there in person to be with their loved ones. So Southern Health NHS Foundation Trust, one of our flagship customers, they approached us nearly 2 years ago now with the need to put virtual consultations in place. A very vast footprint of population that they cover in the South region. And the key things they wanted to do was improve patient access to services, improve the experience for their customers and their patients, improve the outcomes, improve the efficiency of a clinical service, and also deliver cost savings. And the way we did this was work with them directly to create a user-friendly version of our virtual consultation platform. And what this has meant is that we've had some really tremendous uptake and feedback from both patients and from clinicians. And the next slide will show you, no, it won't. The next slide will be with you in a second. The impact that's had has meant that we've had over 5,100 video appointments since April 2020, and also over 169,000 minutes of video calls in April alone. So not only is that enabling patients at home to carry on receiving their long-term care, but also connecting new patients who would often need to be in the trust and couldn't be there physically to have those appointments. And we can see the uptake from when COVID struck in that late February to March, and how we really uptook this platform to over 5,700 calls in June. We see it's slightly starting to plateau now that we're getting more in-person consultations happening, but still we're seeing a lot of usage both remotely and in person to complement each other. And for a patient, this is their experience.
I like making use of video appointments because after you've met with your Parkinson's nurse at least once, then you're able to meet with her almost as if she's in the room without having the travel problems and car parking issues. In other words, you're saving a lot of time, not just for yourself, but also for the very valuable Parkinson's nurse. We were very surprised to find that the video system was really easy to use on a normal PC or on an Apple Mac, as I have. No problems at all. I think we could also use these video sessions in other ways, such as 2- or 3-way meetings, because we've tested that capability out and found that actually worked really well without overcrowding things. So yeah, easy to use and usable by more than one party could be helpful when you're talking to several specialists at a time.
And from a clinician's perspective also,
when I first came into my role, my predecessor did all home visits, and that's what I carried on doing. But the workload has got larger, more and more people have developed Parkinson's, and therefore I'm finding that I don't have capacity to do as many home visits. So I was looking for ways of how could I reach out to these patients and manage to speak to everyone. And I'm finding that the video appointments are saving time. They're allowing me to do a lot more work and make contact with patients, and as well as saving fuel, so we're saving the planet. Well, I think my patients like to have video appointments because they like to have contact with me. They find it reassuring that they can ring me up and they can speak to me within a few days, and I can hopefully answer their queries and come to some resolution. The fact that we can actually have a face-to-face, and I don't mean person to person, they can actually see my face. That helps them with their understanding of what I'm trying to do for them, and also my understanding of what their problems may be. They do enjoy, for the most part, having these appointments because it gives them that freedom without having to come in and see me and without me having to make the journey out to see them.
So what's next in terms of Visionable and where we go with the NHS? Well, we've got 3 key areas of focus as a company. First of all, is ensuring that both clinicians and patients continue to embrace new ways of working during and post-pandemic. Also continuing to ensure that clinicians are at the centre of digital transformation and in everything we do. And also the continuous evaluation and reflection on what's worked and what's not worked, so that we can continue to push the boundaries of possibilities. And where we see things going and where the future we think lies can be seen in this short clip from a presentation and a demonstration we did at Millbrook in conjunction with O2, Samsung and Millbrook themselves.
Ambulance service, what's your emergency? Is the patient breathing? Can I take some more details, please? What's the patient's name?
Patient care is hugely important in the NHS. It's number one, it's the top of everybody's list, and everybody wants to make sure that we've got the right care at the right place at the right time. My name's Linda Simpson and I'm the telemedicine manager for the East of England Stroke Telemedicine Partnership. We have 7 hospitals across the East of England who use an out-of-hours stroke telemedicine service. So what it means is our 7 hospitals out of hours have rapid access to a stroke consultant to help in the decision making for thrombolysis for patients suffering from an acute ischemic stroke. Strokes are sometimes called heart attacks of the brain, and we know that every minute that the brain is starved of oxygen, there's hundreds of millions of brain cells that are dying. So time really is of importance because we're looking at the brain and saving as much of the brain as we can. The smart ambulance will allow the paramedics and the emergency medical technicians, who are the key clinical people working in the back of the ambulance, to be able to link into the resources that they need for their patients.
Smart Ambulance is trying to bring together the capabilities of 5G to make a difference to healthcare. In the trial that we're doing at Millbrook, we're using the Visionable technology, which is high-speed, high-definition video conferencing and image transfer, giving the paramedics the opportunity to speak to specialists back at the hospitals and have specialist knowledge brought to that crisis situation. We worked with Samsung as well, so they provided the devices that we loaded the software onto: lapel-based cameras, scanners, video conferencing equipment and smartphone devices.
So there's endless possibilities as to what can be achieved using Visionable in a healthcare setting. If you've got questions from the presentation today, please do reach out to any of the team you see on the event platform, or alternatively come to our website, www.visionable.com, or follow us on Twitter @VisionableG and on LinkedIn. And thank you for your time.